to just discuss the importance of this new technology in diabetes management. Some housekeeping: if you have a question, I would just bring your attention to the chat room on the bottom. You can put in a question, and then at the end of the presentation, we will open up for additional questions. So throughout the presentation, you can go ahead and write a question, and then we'll address it at the end. Okay, so Roy, if you'd like to begin, that would be great.
All right, well, thank you, Regina, and thanks to everyone for taking the time today. It's very important during this time to stay safe and utilize technology to help manage a difficult disease like diabetes. So hopefully this presentation will help, and of course, any questions, please type it into the chat box. So just a little overview on type 1 diabetes and COVID-19. It is important to note that having type 1 diabetes does not make you more susceptible to contracting COVID-19. So that's really important. So having diabetes, having type 1 diabetes will not leave you more vulnerable to contracting COVID-19 if your diabetes is well managed. So that's the really one important thing that the evidence is suggesting, that individuals with well-managed type 1 diabetes are not at a higher risk of contracting COVID-19. And if by happenstance or by chance, if COVID-19 is contracted, if glycemic control is good, a person with type 1 diabetes is not necessarily at a higher risk of developing serious complications from COVID-19. Those people that are at the greatest risk of complications due to COVID are those with consistently elevated blood sugar levels, so poor glycemic control, and those with a comorbidity, such as heart disease or lung disease. So this is where monitoring diabetes during this pandemic is even more crucial. It is important to monitor your blood glucose and ketones more than usual. Technology such as CGM can help with that, and it is important that that people with diabetes do intensify their metabolic control as needed. So be able to use your treatments a bit more aggressively, take advantage of technology such as CGM to get to those lower A1Cs, spend more time in range, and it's very important to be able to utilize technology such as telehealth or remote consultations to reduce exposure to the virus. So by staying home, staying safe, you could protect yourself and protect others from potentially contracting the virus and exposing yourself to potential complications. And this is exactly what the CDC recommends to stay safe during these times. Leveraging telemedicine whenever possible is the best way to protect patients and staff from COVID-19. So taking advantage of technology such as CGM, using digital apps that you're able to log your events, such as your food intake, your exercise, your activity, and being able to share that information with your providers is of utmost importance. And it allows the provider now to get information that can help them manage diabetes remotely. You don't necessarily have to have an in-person visit to be able to be successful when managing diabetes. And the promise of telehealth has been around for a long time. So this is actually a picture from a 1962 sitcom, The Jetsons, where they're showing how a video conference or telehealth visit could potentially take place. So telehealth has always been a part of that aspirational aspect of medicine, where you could get the benefits of treatment and care from your home setting. But in 1962, the technology wasn't really there to to allow for this in real life. But here we are today where the technology, all the tools, all the resources that are available can truly make telehealth a reality and very successful to help you and your loved ones manage diabetes. So how do you prepare for a telehealth visit? So that's very important. Preparation is essential to have a successful telehealth visit, and that's where really making sure that you take a series of steps and prepare for that visit. For example, if you're using a virtual visit app, you'd want to log on at least 10 minutes before the scheduled appointment to make sure there are no issues. And make sure you test out your technology the day before. So you want to make sure if your browser is updated and the most recent version. If you need any webcams or video conferencing software, if your computer or your tablet needs to be updated, make sure that you test everything out so then you can address these issues ahead of time. Not during the visit where potentially there could be an issue which will cut your visit short and would have to be rescheduled for later down the road. Also using your time wisely. So the best way to do that is to maybe come up with a list of questions before your telehealth visit and maybe email your questions ahead of time to your provider so they could potentially plan and prepare for the visit. So having those questions outlined, having the questions written down and then sent ahead of time would be very helpful to have a successful telehealth visit and for your provider as well. And then any information that you have too. So you'd want to download your data and your reports in that preferred format. So make sure you're using, so any apps that you're using, make sure your provider uses those apps and are able to view reports from those apps. Have it downloaded in that preferred format. So if you use a 14-day report, for example, if your provider prefers that, and send it to your provider in advance. Make sure that they're able to view these reports so then they can provide feedback and make adjustments in that diabetes treatment plan from the data that you're providing them. And also having a backup plan is important. So having printouts of the reports, maybe if you can't access them during the visit. Sometimes screen sharing is difficult, or if you need a webcam, maybe having your cell phone camera as a backup. So there's other aspects of telehealth. Just make sure that you have some kind of backup plan just in case the initial technology or the initial plan doesn't really work out. And this is where CGM can really help with a successful telehealth interaction. It's just so much data that's available to providers and to yourself, but really capturing all that information is of utmost importance. So you want to make sure that that you are capturing that information using apps that you and your provider are comfortable using. So really having that conversation to discuss what apps that will work for you and your provider. So apps such as Clarity or Gluco or DreamMed or Tidepool, which one works best for you and your provider to capture all the information you need to be able to have a successful telehealth visit. Are you and your provider able to share screens when reviewing reports? So how are you going to look at this data? How's the telehealth visit going to be conducted? So maybe asking these questions ahead of time so you can be sure that the data can be reviewed and then meaningful adjustments can be made as a result. And then also, in addition to reports, technology and such as Clarity, CGM technology, the G6 has specific aspects of the CGM, which can really help you spend more time in range. So make sure you're maximizing the use of technology such as the G6. So are you logging your events, your insulin dosing, your diet, your activity? Are you taking advantage of the alerts and alarms, customizing the thresholds so you can take action to spend more time in range? are using features such as urgent low soon, and then also enabling things like real-time sharing with as many loved ones and caregivers as possible. And using all aspects of the technology will help you spend more time in range as well. And that is the nice part about the G6. It is considered a integrated CGM or an iCGM, and it allows the CGM or the G6 to share information with insulin pumps and pens, as you guys well know, or with many other apps. So Dexcom probably has the most partners of any of the CGM technologies. You can have your information viewed on Apple Health. You can take advantage of apps such as Under My Fork. The information can be pushed out to Clarity. You can use other apps such as Gluco, Tidepool, OneDrop. So there's a number of options available to view your CGM data. You're not just restricted to the G6 app and the Clarity app. So really understanding what apps work best for you and your provider is very important, and then making sure that information is shared in a way that can be useful for both you and your provider. So logging your data, again, is very important. Food, activity, medications. In the past, I mean, probably a long time ago, there were stacks of papers, a lot of journals, a lot of things to keep track of, and a lot of opportunity for missing information. Now with the smart device, the amount of information that can be captured is tremendous. Here I have a report from that Companion, their Insights by InPen report. So here you have the glucose information, the insulin information, the carbohydrate information. All this information is captured by the app, and the reports can be viewed by you and your provider for again meaningful discussions and adjustments and changes in that treatment plan. Here's another app. It's called Under My Fork, and the great part here is these apps really simplify data collection for users. Where here you just take pictures of your food. It integrates data from the CGM, and then it actually takes the food items where you have the best time in range and shows you that, versus the food items where you didn't spend as much time in that optimal glycemic range. So really helping you and your loved ones identify food options which allow you to spend more time in that target range, in that optimal glycemic range. So really, it's just tremendous amounts of data that's available, a lot of opportunities to capture the data, and then the apps do a lot of the work where they integrate the information and provide useful outputs for you guys to take a look at and make changes in your diet and your activity as a result. And here I just want to give a little overview of Dexcom Clarity. So Clarity is our report-based system. It allows you to look at your glucose information, the last 90 days of glucose information, in a report-based format. And the nice part here is there's actually a Clarity app as well. It really simplifies the information, the glucose reporting information, where it shows you how much time you're spending in range over a certain time period, your average glucose during that time period, your hypoglycemia risk. But it is important to take advantage of the full features of Clarity. So Clarity does allow for